Hi everyone, welcome back to the Australian Rotary Health podcast called The Research Behind Lift the Lid. I'm Jessica Cooper, and today on episode 49, we will have a chat with Professor Viviana Wuthrich. From 2017 to 2018, Viviana received a mental health research grant from Australian Rotary Health for her project Psychological Stepped Care for Anxious Adolescents in Community Mental Health Services, an effectiveness trial. Viviana is a professor in the Department of Psychology at Macquarie University and is the director of the Centre for Ageing, Cognition and Wellbeing. Viviana's research interests relate broadly to understanding and treating of mental disorders across the lifespan. So welcome to the podcast, Viviana. It's great to have you here. How have you been?
Yes, I'm doing well, thank you. Thanks for having me.
Yeah, no problem. It's great to have you. So your research project focused on the stepped care approach for helping adolescents with anxiety. For anyone listening who might not know, what is stepped care and what led you to decide to use this particular approach?
Yeah, so stepped care is a health framework which theoretically is about providing health services to people that are more efficient and are more cost effective. And so the idea with stepped care is that when someone presents for, let's say, a mental health issue, they would first receive an intervention which is evidence-based, so one that we know would work, but it's a type of intervention which requires lower costs to deliver that service. So a good example is internet interventions, which are often then supported by very brief therapist calls. So therefore it costs less to deliver that particular intervention than intervention which requires someone coming in and seeing a therapist for, an hour every week. And the idea is that then if someone has not benefited sufficiently from that first step, then they would be moved up to a second step, and the second step would require more cost and higher therapist hours, for instance. And in some stepped care interventions, there is a step 3 and there's a step 4. And the idea is that because you can treat hopefully a good chunk of people with those first steps, you actually then save money, but you're still providing good evidence-based interventions. So theoretically, this sounds like a very attractive model that you can imagine would really improve the health services and mental health services around Australia. And while it's sort of been rolled out in a slightly different model throughout the UK, there's actually been very few scientific trials to see whether it actually delivers on its promises. So the very few trials that have been done, one of them done at the Macquarie University Centre for Emotional Health Clinic, led by Professor Ron Rapay, and that demonstrated that, yes, there really were some great benefits to using stepped care, but that was in a university clinic, and we know how highly controlled those clinics are. So really the question is, do these models work in the real world? Theoretically, this is where they should be the most impactful. And so this project was really taking this stepped care model and applying it into a real world setting, and it really is a world first in terms of a trial.
Yeah, well, it definitely sounds like a great option, to try and, deliver those mental health services to those who need it, especially when they can't see a therapist. So this study involved conducting a trial of the effectiveness of stepped care. How did you go about doing that, and what were your aims?
Yeah, so we knew this might be challenging to go into a service and basically try and change the way they deliver therapy. So we were very focused on adolescent anxiety in this particular project. And so we co-designed with the local health district managers how we might be able to apply stepped care approaches within their services. So we tried to use as many of the existing measurement tools that they already used in those services. And so we were really just changing the way therapy would be approached in those services. We actually used Headspace Centres in our local area. And for anyone listening from an international audience, Headspace are our sort of walk-in or drop-in mental health services for adolescents, which are available essentially for free for an adolescent. And so we randomly allocated the Headspace Centres to either be part of this stepped care or to deliver this stepped care approach, or to just deliver treatment as usual. And so the idea being that any adolescent with anxiety that walked into those Headspace centres would either receive treatment as usual or they would go through this stepped care approach. So in the stepped care approach, an anxious adolescent would first be offered internet intervention, our chilled out Cool Kids program, which was 8 modules, and it was supported by 4 brief therapist telephone calls. At the end of that intervention, if they were not better, they wanted further help, they would then come into the Headspace clinic and receive up to 10 sessions of a face-to-face cognitive behaviour therapy, the Cool Kids program. And so we basically measured then, what were the differences in terms of the clinical effectiveness between the 2 programs, what were the differences in terms of wait time, what were the differences in terms of quality of life, what were the differences in terms of the number of therapist hours used. And most importantly, sorry, I almost forgot, we really wanted to understand the acceptability and barriers to this particular approach. And so we then actually asked for feedback both from the adolescents and the clinicians about, whether they liked this stepped care approach.
And yeah, it sounds like you measured a lot of different outcomes there. What would you say were some of the key findings from the trial?
Well, the key findings were that stepped care was beneficial. However, it was not all rosy. So it was sort of did it work, yes and no type of response. So we did find that stepped care produced similar outcomes on a range of things. So there were similar reductions in anxiety symptoms. There were similar improvements in quality of life. There was similar treatment satisfaction for those adolescents that had stepped care and those that had their usual treatment services. We did find that the stepped care was associated with less therapist time. So we could say that probably it is less costly. In fact, we found that the stepped care approach used 4.5 hours less therapist time, right? So it's probably a pretty reasonable saving in cost. And that same time produced same therapy outcomes. So that's actually a really great thing about the stepped care approach. To our surprise, we didn't find any differences in waiting times. So we had thought that by offering internet treatments, that would mean that adolescents wouldn't have to wait as long. They'd be able to be accessing services quicker. We didn't find that to be the case. But really that pointed to difficulties with the way the services are set up themselves, which I'll talk about in just a moment. We did have some challenges. This was definitely not an easy trial to implement. And in fact, when we looked at the acceptability and feasibility, the results were really very mixed there. So on one hand, we found that, we had these similar benefits. We found that adolescents were engaged at similar levels, in terms of the internet program and the treatment as usual. But we did find that the use of the acceptability of the therapist calls that supported that internet program was really very mixed. All right, so clinicians did report a lot of difficulties getting the adolescents on the phone. Now, any parent would know that this is completely true. This is, of course, what we would have found. Adolescents just often didn't answer their phone, which made it very hard for clinicians to deliver their support call. Sometimes when adolescents did answer the phone, they were often really embarrassed to talk if they were in public. They didn't want to talk to their therapist, which is fair enough. And so clinicians reported that they found that hard to then have a good sense of where the adolescent client was actually up to in terms of their treatment. So that was definitely something that was a little bit challenging. A mark of success might be that at the end of that step 1, only 23% of adolescents decided they needed further help and went on to step 2. So, there was definitely a lot of adolescents who said that they benefited from the program, but it's also true that some of them just went on and got help elsewhere. All right, so it's a little bit hard to know how many of those, it was about a third said that they were better, a third said they went and got help elsewhere, and a third just didn't give a reason for why they didn't want to go on. So, certainly more research is needed. But when we took on board the feedback from adolescents and clinicians about the acceptability of the stepped care approach, this is where findings really were very mixed. So the clinicians and the adolescents themselves reported really strong preferences in being able to choose whether they had the internet program or a face-to-face program. And that was really one of the clearest messages that came from this project, is that while these stepped care interventions did work, some of the adolescents really would just have preferred to have been able to go straight to face-to-face. And we saw that there were a couple of adolescents that refused to use the internet program, giving that reason specifically. There were just 3 of them, but they said, look, I will wait, please, until the face-to-face component. We did find some feedback from clinicians about challenges in delivering a therapy according to protocol. So there were definitely some clinician preferences in which they would prefer to be able to pick and choose the therapy elements that they think is best for this particular population. And the other piece of feedback was just that the Headspace Centres were not really set up to deliver stepped care interventions. And that is the way they're funded. Clinicians are funded. So there's no one really funded at the right level to be able to deliver those telephone calls, for instance. And so this just made the whole process just quite challenging for the services themselves. So really the Headspace clinicians were recommending that future step care approaches would have a dedicated salaried staff member who would be dedicated to deliver those early therapy steps. So overall, there was definitely success, but it definitely wasn't smooth sailing.
Well, despite all of those challenges, it sounds like you really learnt a lot from this research trial, and I guess you can, put all of that together into some further research, hopefully. Is that something that you've received further funding for at the moment, or are there plans in the works to conduct further research into this area?
Yes, look, all of those things. I mean, this was definitely a trial that had a lot of learnings. I think not just for me personally, but I think, we've published this in the literature because it really is what makes the rolling out of evidence-based interventions into practice really challenging. It was a really important trial because it helped us to understand the very clear barriers that are going to be in the way, and ideas then about how we solve those barriers so that we can really move more of this evidence-based practice into the real world settings. So while this study, we had quite a number of delays along the way because we had changes with staffing and required retraining. And so these studies have actually only just been published now. And so we're hoping that these results now will be used for future funding specifically around adolescent mental health. But the learnings from this trial were actually used to gain NHMRC funding for a very large stepped care evaluation in older adult mental health. So we're doing that now in 6 mental health services in New South Wales for older adults. And the learnings from this trial very much governed the design of how we are trying to approach stepped care in those particular services. So while this was in adolescent anxiety, the results are really far-reaching because they really have implications for how we translate any of the interventions we develop in university clinics into the real-world setting.
Yeah, absolutely. And before you mentioned that the intervention was used in Headspace Centres, do you see that this becoming part of routine practice in the future?
Not yet. So it is true, though, that the Headspace Centres do go on to continue to use the face-to-face version of Cool Kids, right? So they do like that. They like the evidence base of it. But the idea of applying one step and then another step is something that I don't think Headspace Centres are ready to pick up just yet. And that's because now we've learnt really we need to make some changes to the way we deliver that, whether it be about letting consumers choose the type of intervention they receive or allowing clinicians to sort of decide that, a particular case might need to be stepped straight to step 2 rather than going through an internet program. I think these are the sorts of challenges we now need to overcome.
Yeah. And I guess, when thinking about the implications of this research, what do you think it might mean in terms of the mental health of young Australians in terms of helping them?
Yeah, look, I think one of the profound messages was really how much consumer choice plays an important role in us thinking about how we deliver these sorts of interventions. It was a very clear message that sometimes adolescents loved the internet program, that they could do it in their own time, that there were adolescents that could do it remotely from areas where they normally couldn't walk into a Headspace Centre, and they found it beneficial. But there was also clear messages that for some adolescents, They really just wanted that face-to-face contact. And so I think we need to think about ways that we can really build that into our scientific trials, where consumer choice is part of what we consider in giving interventions. And so, in fact, it was actually that feedback that when we were applying this stepped care intervention in older adults, we took on board. And so in the older adult trial, the consumers are actually offered an internet program or a work at home program, both supported by brief telephone calls, because we decided that we would try and bring some choice in there, recognizing that some older people may have difficulties using the internet or may not want to use the internet. So we'll see whether that small amount of choice has actually helps the engagement in stepped care in that particular age group.
Yeah, and I guess it really tells us that, you know, not one thing is going to work for everyone, and that's why research is so important, so that you can, you know, try and test different things that might work for some, but might not work for others.
Yeah, absolutely.
And the Rotarians who support our research always love to hear about the positive outcomes from the research that they fund. Would you like to tell our Rotary audience what this funding has meant for your research career personally?
Well, look, it's a world first, and it's already really cool to have a world first where you know that even though perhaps it was a small study and gosh, it was hard work, that, you know, it really has really important results. And so that means that there will be a stepping stone paper that really, as I said, it really helped us to achieve the, NHMRC funding, which is about $1.2 million that we received there to do that stepped care evaluation in older adults. And these things together then will lead to much bigger, funding opportunities, which mean that we can really make an impact on how these services deliver treatment. It's these smaller trials that really build to much bigger trials that then have the lasting impact.
Yeah, absolutely. And as I mentioned earlier in your bio, you're interested in treating mental disorders across the lifespan. And you may have heard that recently Australian Rotary Health announced that we're going to be allocating our funding to research projects that are targeted specifically at youth between the ages of 0 to 12. Do you have any particular comments on the importance of continuing mental health research for this age group?
Yeah, look, this is a great decision by Australian Rotary Health because we really know that mental disorders can be prevented when we use evidence-based interventions, and we can prevent them from very early in life. There's been a number of really key findings that show that if we think about anxiety, that we can actually change the trajectory of children's outcomes by targeting these early warning signs, in the preschool years, for instance, all right? And if we can do that, then it offsets that whole series, the cascade of negative experiences and negative consequences that can occur. Because once a child has a mental disorder as a childhood, we know that makes them more vulnerable to more severe and more mental disorders when they get to adolescence. If their anxiety hasn't been treated in childhood, the chance of them developing depression as well and substance abuse in adolescence is much higher. And we know those things then make people more vulnerable to further mental disorders and unemployment, etc., in adulthood. So I think it's a great strategy, and I think it's how we can probably get the best bang for our buck, so to speak, by targeting those early years with preventative efforts.
Yeah, absolutely. Well, thank you so much for your time today. Was there anything else that you'd like to add before we wrap up?
Well, I just wanted to say thank you again to Australian Rotary Health for the funding for this particular project, but also to all the Rotarians who actively raise money for these projects and other projects that are done by Rotary, and of course to your donors. I really believe that this particular research program continues to lead to really impactful research being done across Australia, and you can really start to see the significant impacts that it's going to have on people's lives. So yeah, just congratulations, and thank you again for the opportunity.
Well, thank you for keeping up all the good work. Yeah, it's very important, the research that you're doing. So yeah, thanks again.
Thank you.
That was the 49th episode of our podcast called The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to make a difference to mental health and how they are helping us on our mission to lift the lid on mental illness. If you can, please support important mental health research like Viviana's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.